Common injuries of the knee and lower leg. Patella fractures. It results from direct blows such as knee hitting with dashboard in motor vehicle accident, fall on flexed knee, and forceful contraction of quadricep muscles during movement. Transfer fractures are most common in patella fractures. Femoral condyle fracture. These injuries are secondary to direct trauma from fall with axial loading and blow to distal femur, mostly common in players. Anterior cruciate ligament injury. It is occurred due to deceleration, hyperextension, or internal rotation of the tibia on femur. These are more common in sports such as basketball and team handball. If it is associated with medial meniscus tear, then you may hear pop sound and notice swelling around the joint. ACL injuries are also common due to non-contact injuries, with most of these being sustained when the femur is rotated on the planted leg with the knee close to full extension during cutting, landing, or stopping. These kind of activities involving sudden changes in direction combined with acceleration or deceleration of the body produce large rotational movements or various valgus forces at the knee joint. ACL rupture also occurs due to excessive anterior translation or rotation of the femur on the tibia. As shown in this picture, ACL injuries occur when bones of the leg twist in opposite directions under the full body weight. Surgical repair. Surgical repair of ACL rupture involves reconstruction of the ligament using either the middle third of the patellar tendon, the semitendinosus, or the semimembranosus and gracilis muscles. Problems that follow trauma to the knee, whether the trauma is injury or surgical induced, it include notable weakness or loss of mass in the knee extensor muscles and dramatic reduction of the joint range of motion and impaired joint proprioception. The other factor which play a major role in precipitating these changes is muscle inhibition. Muscle inhibition is an ability to activate all motor units of a muscles during maximal voluntary contraction. Muscle inhibition can persist for an extended time and may be responsible for long-term strength deficits that alter joint kinetics and lead to osteoarthritis. Posterior cruciate ligament injury. It is less common than the anterior cruciate ligament injury. Its mechanism of injury is hyperflexion of knee with foot plantar flex. When the PCL is ruptured in isolation with no damage to the other ligaments or to the menisci, the mechanism is usually hyperflexion of the knee with the foot plantar flex. Impact with the dashboard during motor vehicle accidents, on the other hand, with direct force on the proximal anterior tibia, result in combined ligamentous damage. It is treated non-operatively. Medial collateral ligament injury. Blows to the lateral side of the knee are much more common than blows to the medial side because the opposite leg commonly protects the medial side of the joint. When the foot is planted and the lateral blow of sufficient force is sustained, the result is sprain or rupture of the medial collateral ligament. It is mostly common in contact injuries like in football. MCL is more frequently injured, while both medial and lateral collateral ligament sprains occur during the wrestling. Meniscus injuries. Because the medial collateral ligament attaches to the medial meniscus, stretching and tearing of the ligament can also result in damage to the menisci. Mechanism is usually squatting or twisting maneuvers. There is locking of the knee or flexion or extension that is painful or limit activity. Medial menisci more commonly damaged due to its attachment with the medial collateral ligament. It is a combination of injury. If it is occur with ACL rupture, then the normal stress distribution is disrupted such that the forces on the medial meniscus is doubled. Iliotibial band friction syndrome. The tensor fasciae lata develops tension to assist the stabilization of the pelvis when the knee is in flexion during weight bearing. This can produce friction of the posterior edge of the iliotibial band against the lateral condyle of the femur around the time of foot strike. It is very common in distance runners, so it is called runner's knee. It is mostly occur due to training errors and anatomical malalignments. It also causes due to excessive tibial lateral torsion, femoral anteversion, gynovalgum, gynovarum, and increased Q angle, etc. This is the iliotibial band syndrome. Breaststroke knee. A condition of pain and tenderness localized on the medial aspect of the knee is often associated with performance of the whip kick. This kick used with the breaststrokes. The forceful whipping together of the lower leg that provides the propulsive thrust of the kick often forces the lower leg into the slight abduction at the knee joint, with subsequent irritation to the medial collateral ligament and the medial border of the patellar tract. The likelihood of the acquiring breaststroker's knee is much lower if the angle of the hip abduction is between 37 degree and 45 degree at the beginning of the propulsive phase of the kick. It will increase the onset of the knee pain. Patellofemoral pain syndrome. Painful patellofemoral joint motion involves anterior knee pain during and after physical activity, particularly activities requiring repeated flexion at the knee joint, such as running, ascending and descending stairs, and squatting movements. It is caused by anatomical malalignment, vastus medialis oblique and vastus lateralis muscles weakness, large Q angle, and patellar maltracking. These are the causes of patellofemoral pain syndrome. This is the patellar pain syndrome. Normal Q angle and abnormal Q angle. Chondromalacia Patellae. It is an overuse syndrome of the patellar cartilage which is caused by patellofemoral malalignment, which leads to tracking abnormality of patella, putting excessive lateral pressure on the articular cartilage. It is mostly seen in young active women. Pain worse with stair climbing and rising from a chair. It is normal knee cup and in chondromalacia Shin Splints. The ankle region involves generalized pain along the anterolateral or posterior medial aspect of the lower leg is commonly known as Shin Splints. Overuse injury is often associated with running, dancing on the hard surface and running uphill. Thank you.